Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you all from the world of medicine. How intracranial hemorrhage in patients with infective endocarditis can cause neurological deterioration. According to a recent study published in the Journal of the American Heart Association, cardiac surgery conducted within 30 days in case of infective endocarditis with intracranial hemorrhage was not associated with a higher mortality rate, rather with an increased rate of neurological deterioration. The researchers evaluated this impact of early surgery in patients with infective endocarditis suffering intracranial hemorrhage on post-operative neurological deterioration and even the all-cause mortality. The study included around 355 patients among 16 studies, out of which 9 studies examined the impact of surgical timing. Only one study examined the fate of the patients with infective endocarditis and those having intracranial hemorrhage who were treated conservatively despite having an indication for cardiac surgery, showing higher mortality rates than those who underwent surgery. It was hence observed that an early surgery, that was cardiac surgery within a period of 30 days, was associated with a higher risk of neurological deterioration. Thus, it was concluded that cardiac surgery for such patients within 30 days of window period was not associated with a higher cause of mortality, but with an increased rate of neurological deterioration. How congenital heart disease in mothers can affect their kids. Previous smaller studies have already reported a higher offspring risk for mothers with congenital heart defects, but the researchers of the present study, they wanted to confirm those findings in a larger population and also delve into specific cardiac defects. So as per this new research, congenital heart defects may be much more common among children of women with heart defects than of men with heart defects. They looked at more than 2 million children and compared the risks of congenital heart defects in children with and without a parent of having these defects. The study, which is published in the American Heart Association's journal Circulation, it found that the risk of these congenital heart defects was nearly double in the offspring of affected women compared to the offspring of affected men. In addition, when compared the children of women without the congenital heart defects, children with heart defect mothers had more than 5 times the risk of having a heart defect, while for children of men with these defects, the risk was triple. These findings hence are more important in genetic counseling and prenatal investigation, especially now that an increasing number of persons with congenital heart defects are surviving to adulthood and are healthy enough to parent children. The researchers hence ended with a question as to why heart defects were more common among the offspring of women with congenital heart defects. Increased effectiveness of metformin in treating infections. As it is an old saying, old dogs may not learn new tricks, but old drugs can. According to a research team based in China, a collaboration found that metformin, a small molecule drug that has been used to treat type 2 diabetes cases specifically for more than a period of 50 years, can improve the efficiency as well as the efficacy of antibacterial treatments for quick wound healing. The results were published in the Nano Research Journal, and the abuse of antibiotics has led to serious bacterial resistance with about 1.27 million deaths in 2019 due to multi-drug resistant bacterial infections. Bacterial resistance does pose a fatal threat to human health. Non-antibiotic antibacterial technologies and antibacterial nano agents with specific catalytic activities not only produce toxic substrates to directly kill the bacteria, including the antibiotic resistance bacteria, but can also reduce the risk of the bacteria developing resistance to those particular drugs. The researchers set out to improve the antibacterial power of a nano agent while also lowering the toxicity to healthy cells, a risk that can be difficult to control due to the invasive nature of the infection. They speculated that the integration of metformin with a chemodynamic therapy nano agent would improve the antibacterial effect. The researchers stirred metformin with copper chloride to form nanosheets whose surface was capped with the metformin molecules, enhancing the nanoagent's positive charge and strengthening the antibacterial effects. Hence, it was confirmed that when metformin is used as an antibacterial agent alone, excellent antimicrobial effects were achieved. The newly found rare benefit of gut bacteria that leads to no control of hypertension. A new study from the University of Toledo College of Medicine and Life Sciences has shown that gut bacteria can reduce the effectiveness of certain blood pressure drugs. The research that I'm talking about, published in the journal Hypertension, it offers the first clues to what has been an elusive mystery. Why do some people not respond well to medication? The question still persists. High blood pressure is often called a silent killer because it doesn't usually cause symptoms. However, there is a big number of population of individuals who know they have hypertension but still cannot get it under control even though they're taking multiple blood pressure drugs, thereby causing a major concern. Among those with high blood pressure, an estimated 20% have what's known as resistant hypertension, meaning their blood pressure remains at high levels despite aggressive treatment. The only way to manage this by doctors is these patients is adding or switching medications and increasing the current dosage with the hope that they can find something that works. Until now, they haven't had any clear indication what the mechanism is for resistant hypertension. In recent years, the researchers have more intently examined the link between an individual's blood pressure readings and the unique collection of bacteria that lives in their gut. However, this is the first study to examine this association, that is the impact of gut bacteria on blood pressure medication itself. Toledo scientists, they compared the effectiveness of the antihypertensive drug quinapril with normal gut bacteria against those whose gut microbiota had been depleted by high dose of antibiotics. The researchers found a clear difference between the two, with those who were given antibiotics first responding much better to quinapril. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.